Hello, my name is Dr. Michele Robison, and I'm a psychologist. I have worked with teenagers for pretty much about 29 years now. And in addition to that, I do a lot of professional speaking in schools, helping students and those who work with students understand how to best help students flourish and thrive using the science of well being. I want to take a moment to talk about the importance of well being strategies when considering suicide prevention in schools. Most states are now requiring that everybody in their school districts be trained in suicide prevention. And this is really important. I mean, we know that suicide is on the rise among youth and has been for quite some time. In fact, it is the second leading cause of death of 15 to 24-year-olds and the third leading cause of death of 10 to 14-year-olds. One study showed that 20% of high school students had serious suicidal thoughts, and 9% have made at least one attempt. Traditional suicide prevention focuses on what do we do when we have a student who is feeling suicidal. And by all means, this is really important for anyone who works with students to be trained on knowing what to do, because if something can be done to prevent a student from acting out on those thoughts, then that's really important and needs to happen. I will say, though, that if suicide prevention, traditional suicide prevention, is all we do, we're going to continue to have the tail wag the dog, because traditional suicide prevention does nothing to reduce the number of young people who actually are struggling with suicidal thoughts, because it's all about being reactionary. What do we do when they're already at that point? I would suggest that true prevention and truly being proactive means backing things up and giving students the tools and the strategies so that when they face life stressors, which they inevitably will, that they know what to do to be resilient and flourish and thrive so they don't become depressed and anxious and want to take their life. There are schools in various countries that are now implementing well-being into their schools so that well-being is as important as academic achievement. And we now have over a decade of research that demonstrates that when we do this, we see a really big impact. So that you can't just teach a class in well-being. They've tried that, and the results don't show much statistical significance. However, when every teacher and personnel is trained in well-being, trained in the science of it, and learn these strategies and tools that they can then integrate into their classrooms, it changes the entire school. So it's embedded into every area of the school. It creates a cultural shift, and that's where we see real change, where students are really flourishing and thriving. One of the things I've noticed in the United States is that instead of just looking at academics, I think because depression, anxiety, and suicide are so much on the rise, that they are now taking this whole child approach so that we are addressing social emotional well-being, which is really about how do you help students have healthier relationships, and how do you help have them understand better their own emotions and how to regulate and manage those emotions more effectively, in addition to behavior. So, this whole child approach is really on the right track. It's what we need to do. But the question is how? How do we go about doing this? And like I said, that we now have over a decade of research that shows that when schools make well-being as important as academic achievement and really embed it within the school, so whether you're teaching math, science, English, history, PE, it doesn't matter, that these tools are embedded into existing curriculum so students are learning how to flourish and thrive, and it's creating this overall cultural shift. Let me show you some of the outcomes when schools do this. In terms of academics, the real concern initially, which I think was a valid one, was, well, if we take some focus off academics, and focus on well-being, first of all, teachers' plates are pretty darn full already. And to bring in more information, that is going to affect students' ability to achieve. And actually, the opposite happened. Look at the results. We're finding that students have improved GPAs, higher levels of engagement and participation, and higher retention rates. Because when well-being is embedded into the entire school, it creates this cultural shift and it's a more positive environment. Kids learn better in a positive environment. They want to be in a positive environment, and it's reflected in how well they perform because their grade point averages actually increase. In terms of social emotional well-being, we see reductions in depression, anxiety, and hopelessness. Hopelessness is the biggest predictor of suicide. We also see increases in social and emotional skills and higher levels of optimism. Optimism has been shown to be directly linked to academic achievement. When kids are more optimistic, they tend to have more grit, they stick with it longer because they believe that they are going to achieve if they hang in there and don't give up, which then is reflected in their academic performance. In terms of behavior, we see pro-social behavior, so bullying goes down. Improved health behaviors, so students are getting more sleep. They understand the role and importance of sleep. Sleep is directly linked to mood as well as performance in school. They have better eating behaviors and they're getting out and they're moving more. We see greater levels of self-control, reduction in conduct problems, and reduction in procrastination. These are just some of the benefits when educators are trained in well-being strategies and know how to embed this in their own classrooms so that they can help students flourish and thrive. I truly believe that it's time to really integrate these tools and strategies and train those who work with students so that we can really be proactive and reduce the number of students who struggle with depression, anxiety, and want to take their life. Thank you so much for your time.